A boxer was hit on the mouth. Person is unable to open the mouth. Which unable to open the mouth and protrude the jaw. Which muscle is damaged? That is lateral pterygoid muscle. Lateral pterygoid muscle helps in movement of the jaw and chewing. Next one is H2 blockers are given before surgery primarily to decrease which of the following, that is volume in the stomach. H2 receptor blockers are given. A patient has CVA and loss of appetite for food and drink, tendency to throw. What will be cause of decreased thirst? That is vasopressin is the cause of decrease in thirst. Which fascia covers thyroid gland itself? It is pretracheal fascia covers thyroid gland. Next one is which is not oncogene and causes gene amplification. That is antigen presenting cell is not oncogene. It presents antigen and used for gene and it causes gene amplification. Next in hemostasis, the word gain is for exaggeration of the negative feedback is done. Okay, next question is cyclic AMP acts via which of the following? It acts via receptor. Which of the following is intermediate filament found in the muscle? That is desmin are intermediate filament. These are found in the muscles. Next is which structure helps prevent an excessive muscle contraction? That is Golgi tendon organ prevents excessive muscle stretch, and proprioception is also balancing system. When proprioception is deranged or lesion in dorsal column results into rhomboxide. Next one is increase intracranial pressure, and increase in blood pressure is part of which triad? It is Cushing triad, in which intracranial pressure and blood pressure is increased. Next is a patient who develops petechiae hemorrhage and after road traffic accident, multiple injuries. What will be the cause? Cause is disseminated intravascular coagulation. Okay, next one is a patient with non-fluent aphasia. Which area is involved? It is inferior gyrus of frontal lobe. A patient has no flow oxygen checked in eating. Which of the following most likely there? It is valves are not properly attached to the cylinder. Next is to anesthetize the limb. Which of the spinal cord typically targeted for drug injection? That is dorsal substantia gelatinosa. Next question is aldosterone antagonism primarily act on which part of nephron? Aldosterone acts on ADH acts on collecting duct and aldosterone antagonists are acting on collecting duct to maximize reabsorption of water. Next one is a patient present with sinking of the heart, weakness in the ECG, U wave is there. U wave is indicative of hypokalemia. Local lymphatic obstruction is caused by infection and neoplasia. A patient has experienced muscle pain, stiffness for 10 days, thyroidectomy. What is the reason? Now thyroidectomy has done, then there will be also parathyroid gland extraction is happened. Now hypocalcemia can develop because of parathyroid gland involvement. Macrophage cells in alveoli are dust cells. Dust cells are working or performing the function like macrophage. Okay, next question is which of the following is most common cancer in Pakistan that affects both male and female? Now, cancer that affecting both male and female is lung cancer because of smoking. Posterolateral to thyroid gland is a carotid sheath. It is present in posterolateral aspect. Next one is in emergency procedure you perform tracheostomy. Which vessel can be injured and can cause profuse bleeding? Thyroid artery can cause profuse bleeding and injury.